My name is Jagmohan Chawla. I'm an consultant ophthalmic surgeon after having worked in the NHS for over 30 years. I managed glaucoma all these years, both in the NHS and also in my private practice. Glaucoma is a common eye condition where the optic nerve which connects the eye with the brain gets damaged. And this is usually caused by fluid buildup in the eye, especially in the front part of the eye, which increases pressure inside the eye and leading on to damage to the nerve. This can lead to loss of visual field, loss of vision, if this is not diagnosed and treated early. The symptoms of glaucoma depend on the type of glaucoma. And there are different types of glaucoma and they differ in their presentation, in their symptoms and signs. The main type of glaucoma that we come across in our clinical practice is called open angle glaucoma. This is completely symptomless in its early stages. So patient may not even know that he or she has any glaucoma because there's no pain, no discomfort, unless it gets to a terminal stage or advanced stage when the patient starts noticing that there is something wrong with the vision. In open angle glaucoma, there is a gradual loss of vision with patchy blind spots in the field of vision. And this can affect the peripheral vision as well. So while you're walking, you may bump into things which you may not even see they are lying around in your vicinity. In later stages, it can affect your central vision as well. Acute angle closure glaucoma or angle closure glaucoma is usually symptomatic. It can cause headaches when the attack happens. There is severe eye pain. There can be nausea, vomiting, and blurring of vision. Another classical sign of angle closure glaucoma is halos or colored rings around the eyes. It also causes redness and watering in the eyes. There is yet another variety of glaucoma called normal tension glaucoma. Again, there are no symptoms like in open angle glaucoma, or there are no early signs either. It causes gradual and blurring of vision. In later stages, there can be loss of side vision as well. The difference between open angle and normal tension glaucoma is that in open angle glaucoma, the intraocular pressure or the pressure within the eye can be raised, while in normal tension glaucoma, pressure may be what we call as apparently normal pressure, but the field loss and the optic nerve damage goes on a gradual basis. We also see glaucoma in children. Mostly these are born or they develop glaucoma in early stage in life. There's another variety called pigmentary glaucoma, which is a variant of open angle glaucoma, in which you can again see halos around the light, blurred vision following exercise, and also gradual loss of peripheral vision or side vision. Glaucoma can be, once it is diagnosed, can be managed by different modalities, and these include use of eye drops. This is the most common form of treatment for glaucoma, and majority of the patients, we are able to reduce the pressures to acceptable levels and prevent any further damage by regular use of these eye drops. These drops have to be used over patient's lifetime. That means it's a lifelong medication. If the drops do not give desired effect or reduce pressure to the normal levels, then we add some more drops and use a combination of drops. There are laser treatments available as well. For example, in narrow angle or closed angle glaucoma, we use YAG laser iridotomy, which can be used as a preventive measure or as a therapeutic treatment. In open angle glaucoma, we have laser treatments available like selective laser trabeculoplasty, which works very well. The only problem with this SLT treatment is the effects may not last forever, and you have to monitor the patients more closely with this procedure. If the laser treatment and the eye drops do not work, and the disease is advanced and we are unable to control the pressures, then we go for the surgical option, and which is called trabeculectomy. And this works in about 70 to 80% of the patients. To enhance the effects of the surgical treatment, we also use very potent medications like mitomycin C or 5-fluorouracil to ensure that the opening that we made for drainage of the fluid keeps working and does not scar down. These days, we use what we call as minimally invasive glaucoma surgery procedures, which involve the use of stents or microshunts. There are different types of these devices available and which are used appropriately, whether it is mild glaucoma, moderate glaucoma, or severe glaucoma. Cataract surgery in itself can cause slight reduction in the pressure. And in some cases of narrow angle or closed angle glaucoma, we use cataract surgery or even clear lens extraction to reduce the pressures and cure the condition. As far as glaucoma is concerned, there are several risk factors that we know. Anyone over the age of 40 can develop glaucoma. It's quite rare for anyone less than 40 years to develop glaucoma. If you have a family history of glaucoma, you are more liable or vulnerable to develop glaucoma. Racial predilection is also seen, and glaucoma is more often seen in African, Hispanic, or Asian heritage. If you are very far-sighted or nearsighted, again, you are more liable to develop glaucoma. Injury or use of steroids over a long term can also result in glaucoma. It's also been seen that people who have thinner corneas are more liable to develop glaucoma. There are other risk factors like migraines, diabetes, high blood pressure, and other circulatory diseases which predispose to glaucoma. There are several studies to prove that exercise can reduce the risk of developing glaucoma. Alcohol and smoking both have been linked to increased incidence of glaucoma, especially the smoking. And there are several studies available to prove this. To prevent glaucoma, if you know that you have a family history, you should get your eyes checked on a regular basis. If you are working in a profession which can lead to eye injuries, wear eye protection. And once you've been diagnosed with glaucoma, you can prevent any further loss of vision if you use your treatment properly and take your medications on a regular basis. Regular comprehensive eye examinations can help detect glaucoma in its earliest stages before any significant damage occurs. As a general rule, we recommend a comprehensive eye examination every 5 to 10 years if you are under 40 years of age, every 2 to 4 years between 40 to 45 years, and every year on a 12-monthly basis if you are over 45. This can help us pick up any early changes in glaucoma. And if you have one of those risk factors, you may require a lot more frequent screening of your eyes.